We are back here on the Lynne Hayes Freeland Show. Okay, so what I've been teasing throughout the show is that we were going to have huge medical news for you today. And I'm so excited to have my next guest to introduce once again to you my next guest, Dr. Utibe Essien. I got
nice
it right.
To see you, Lynn. You got it.
Perfect. He is an assistant professor of medicine at the University of Pittsburgh Medical School. We've talked in the past. We talked about the Black community. We talked about COVID. But just this past week, you were involved in some research that was eye-opening, to say the least.
To say the least, that's right. So thank you so much again for having me on, the opportunity to share with the community our work. So my research focuses on cardiovascular disease, and specifically I study one of the most common causes of strokes in the US, which is atrial fibrillation. So atrial fibrillation is an irregular beating of the heart. And the scary thing about it is that it causes strokes in 1 in 4 people who have this condition. And so, but there are incredible medications that are available to prevent strokes, and those are called blood thinners or oral anticoagulants. And so my research is focused on how do we make sure that every patient who qualifies or is eligible for these medications can get them. And sadly, 3 years ago, we published our first paper that showed that Black Americans in particular were far less likely. We saw that they were 36% less likely to get these medications. And the last 3 years, I spent really trying to understand it and really trying to figure out whether that finding could be duplicated in other studies. And so today we published a study using data from the Veterans Health Administration showing that sadly those disparities exist even in a health system that has really equal access to medications for the most part. When we saw that Black patients, Hispanic and Native American and Alaskan Native folks were less likely to get these newer blood thinner medications.
And one of the things that is startling about this is because of the commonality of stroke within that population, African American, Hispanic, and Native American.
Exactly. So that's a great point, Lynn, is that we sadly see that when you have atrial fibrillation, if you're Black or Hispanic, you can be up as many times as 2 times more likely to develop a stroke compared to white patients. And so these are patients that typically should qualify for these medications, but sadly, they're not getting these potentially stroke preventing medications.
So now that we know this information, or we know it again, it's well documented. What do we do with this? What do we do with it?
Yeah, so it's really the next step of my work. You know, this isn't one of those studies that we just show the findings and move on to the next paper, but I have the opportunity in the VA to really dig deeper and to try and understand, okay, what are the reasons that these disparities exist? And what can we do to address them? And so I was recently awarded some funds from the VA to actually study this question and dive in deeply. And that's really what I'm looking forward to spending my time in over the next few years.
So here's one of the things that strikes me, because so often when we talk about healthcare disparities in Black and brown communities, a lot of times access comes up, or the lack of accessibility comes up. But when you're talking about the people that you looked at, access wasn't an issue, correct?
Yeah, so such an important point, how access tends to be what folks bring up. Here, because our patients tend to have equal access again in our VA healthcare system, we don't think it's access alone. And it's of course difficult to say in the type of study that we did what the key drivers are. But I think this reminds us that we have to look beyond access, not just with atrial fibrillation or blood thinners, but in all of the different conditions that we see in our health system, especially as we're talking about now, COVID vaccination and so on.
So one of the ongoing concerns or issues that I hear about often when we talk about medical studies is that people of color don't feel as if they're being heard. They don't feel as if the medical community is listening to them, is hearing them, or taking their concerns seriously.
Yeah, so I've literally spent the last year telling my colleagues that we need to listen, learn, and lead, and starting out with listening and really hearing what our patients' experiences are in the room. That's actually a big part of my research, is to actually interview patients about their experiences with atrial fibrillation. Did you know about these medications, that they are available? What were those conversations like? So that we can actually do that listening part and then continue to learn from our patients to hopefully be able to lead us towards a more equitable future.
I was going to say, I mean, I think the other thing that strikes me about this is so often, especially when it comes to the Black community, we talk about lifestyle changes, we talk about diet changes. I don't know how many cookbooks I've seen, to tell you how to make non-traditional soul food. And those are all things that we need to know and talk about. But this piece that you're talking about is huge.
Yeah, so I really wanted my research to move beyond focusing on the patient, because I think we've done so much of that. Like you mentioned, Lynn, we're talking about diet, we're talking about getting out and exercising more. And we know how challenging that can be for certain members of our community, whether related to the neighborhoods that they live in, the access to healthy restaurants or supermarkets, or even just the time based on their work schedules. And so I wanted to focus my work on both the providers as well as the system, and looking at what doctors, nurses, and other providers can do to help ensure that patients have equal access to care, and then how we can move forward to more system level, policy level strategies to reduce disparities and not put all the onus on our patients.
The other thing that strikes me is, when it comes to Black and brown communities, at the very least, we can be skeptical. We can have reservations. We're not trusting. But when people see researchers that look like them, I think it makes a big difference.
Well, that's part of my job. I have a role as the director of our career enhancement and diversity program for the medical students here at the University of Pittsburgh, to help encourage future researchers from our medical students. And I think the problem is a lot of medical students don't see folks that look like us to be able to go into fields like research. And again, that cycle kind of perpetuates. So I'm really fortunate to have that opportunity. And I hope that we can continue to see just the impact it makes in having researchers that look like you and having a doc that looks like you in addressing some of these issues around hesitancy, fear, doubts, or worries, especially related to medications.
And we got about a minute left. So what's the takeaway for the folks in our audience, especially those that have addressed or dealt with AFib? What's the takeaway for them?
Yeah, so for all the patients out there with atrial fibrillation, ask your doctor about these newer blood thinner medications. And potentially they can help you with managing your atrial fibrillation compared to some of the traditional medications, and compared to not being on any blood thinners. So just ask your doctor about these meds. And for the docs in the room as well who are hearing these data, think about your own practice and how you can help to ensure that your practice is as equitable as possible.
I tell you what, you nailed it the last time you were here. You talked about COVID and you nailed it once again. Thanks for joining us today. Great information. We appreciate you and your research.
Thank you. Appreciate it. Take care.
All right. Good. Take good care. Making a difference. I'll be back with closing thoughts. Don't go away.